Hi, so my name is Bianca Gutierrez, and I will be analyzing Corey Matthews from Boy Meets World and his psychological disorder. So the description of Corey Matthews. Corey Matthews is the main character on the family sitcom Boy Meets World. He's a very optimistic person and tends to overthink a lot of things, especially when it came to his relationship with him and his girlfriend Topanga. Corey's personality is described as witty, goofy, unstable, and is always willing to have a good time. Corey is also really dedicated to his friends, family, and girlfriend, making sure that their happiness was always put before his. If one of his loved ones isn't happy, he will go out of his way, maybe break a leg, to make sure that they are happy. Boy Meets World is a family sitcom surrounding Corey's life, along with his friends and family, and watches how he progresses from a little boy to a young man going into adulthood. So what disorder is Corey diagnosed with? I diagnosed Corey with anxiety because he tends to take care of others before himself, which causes him to stress himself out and have a feeling of fear and uneasiness. One of the examples from an episode was when Corey was diagnosed with hypochondria, which is known as an abnormal anxiety about his health, especially with the fear that he has a serious disease. I don't think that this disorder is diagnosed everywhere because it isn't something you should be concerned about because it doesn't affect your physical health, but makes you feel worried about the idea of having actual disease. These symptoms are more present in Korean than American patients, but still have high levels of anxiety regardless of their culture. Therefore, cultural and personal factors share a role in hypochondria. So these symptoms shown, one of the symptoms shown that Corey displays from hypochondria is he makes things up in his head to convince himself that he might actually be sick. What caused this was that he took a magazine quiz that informed him that he should have died already, which then triggered these thoughts. These symptoms have a long-term and intense fear of having a serious condition and worries that minor symptoms he has could indicate something very serious. He also tends to be paranoid of catching a serious disease. And one of the symptoms that Corey does not display in this episode is dizziness or a sensation of pins and needles. So here is an example from the show. We're gonna go here really quick.
Hello, everyone. Glad you're all here today. Corey?
Is there something wrong?
Well, as you all know, I just came from the doctor.
You have something?
Yes, I have something. What's it say?
He has hypochondria. Chronic and severe hypochondria.
That's right. I'm a hypochondriac.
Corey, it means that there's nothing wrong with you. It means you create stuff in your head.
Yes, well, he gave me these placebos.
Placebos are what they give to crazy people like you to make them think they're being cured of something they don't have.
Okay, so that is an example. Moving on. So the proposed treatment plan for Corey is behavioral therapy and stress management. He can take part in participating in techniques such as meditation or something as simple as breathing exercises. Although these are the most known treatments, there was a treatment plan in this episode where the doctor prescribes Corey with placebo pills, meaning that Corey will take them thinking he has a disease when in reality he does not. Because this show was aired in the late 90s, there was never a big concern for people with mental illnesses and probably not as many concerns for therapy and stress management at this time. A more broader perspective, so I believe that this was an accurate representation of someone with hypochondriac anxiety because it very well helped the audience understand what this disease was and how it can affect someone and their behavior. However, when we're portraying and mentioning mental illnesses in the show or any show, it is not portrayed correctly and can have a negative influence to the public overall because of how crazy the writers describe and dramatize mental illnesses. This can lead people with mental illnesses to not seek treatment because of the negative attitudes within the public. And these are my works cited. Thank you very much.